Hello and welcome to the Health Channel, all health all the time. I'm Laura DeAngelis coming to you from the Baptist Health South Florida studios in Coral Gables. Well, breast augmentations and reconstruction are growing more popular each year, but sometimes implants can cause more complications than expected, and maybe you've been considering a procedure but are looking for a natural look with a less invasive approach. Well, today we're going to talk about fat grafting, a procedure that's being embraced by plastic surgeons nationwide. And with me today are Doctors Daniel Calva and Dr. Roger Khouri. Both are plastic surgeons with Baptist Health South Florida. They're here to tell us the benefits of fat grafting and the difference in recovery time from traditional methods. So Dr. Calva, Dr. Khouri, welcome to the show. We're thrilled to have you both with us today.
Hello, Laura. It's been a pleasure. Thank you for having us.
Thank you.
Okay, absolutely. So again, we're going to speak a little bit later this hour about breast reconstruction following mastectomies, but first we want to talk about the popularity of traditional breast augmentations and reconstruction. So kind of where do those stand today as far as the popularity of these treatments, and what are some of the downsides that might be associated with them?
Well, breast augmentation keeps increasing in popularity. It's one of the most commonly performed procedure today. Hundreds of thousands are done a year. It's really very popular. It's a quick operation, but there are problems. Let's face it, implants don't last a lifetime. There's a threat now, possibly in one in a few thousand, getting lymphoma out of the implant, implant capsulated, etc. Breast reconstruction, on the other hand, is really now mandated. We have to inform our patients when they get a mastectomy that there's an alternative. You could get your breast reconstructed, we could do something for you. And it is increasing in popularity. The majority of women who are having mastectomy are considering breast reconstruction. Really, it's something should be offered to patients.
Okay, absolutely. And again, you know, some of the downsides, you just mentioned one of them. What are some of the downsides that have happened in the past with women who have had implants? Are we talking about things like pain? Are we talking about other conditions that they may experience from having these traditional procedures?
You know, there's actually a slew of complications that can happen from implants, from simple stuff as pain, as you're mentioning, because of the implant being put underneath the muscle. So you're moving the muscle, you're stretching the muscle, that causes pain and discomfort. The nerves can be trapped. There's also rippling. So when the implant puts pressure on that gland, and your breast gland actually becomes smaller and thinner. So all of a sudden you can start to visualize your implant. That's called rippling, and you can see it. Another thing that a lot of women complain about is animation. And animation means the implant moves as you're moving your arms, especially if you're a fit woman, and these women tend to be very, very into their bodies and health-wise. So they have really strong muscles. So whenever they're exercising, they're running, they're in a party and they're moving their hands, they can actually see their implants move back and forth. There could be capsular contractures, which is basically the scar tissue that forms around that implant becomes thicker and it starts to contract, and that's something your body sort of dictates. Your body is the one that's attacking that capsule and it's making it contract, and we don't really know why it happens, but a fair number of women get it. It's been quoted up to 30% of women that get implants can get it.
Wow. Okay, so again, this is a traditional treatment we're talking about, but now again, as I mentioned at the top, there is something revolutionary, I guess we could call it, which is fat grafting. So let's get right into that and talk about why this is revolutionary and what it is.
Well, back in the 80s, where the implants were in the hot seat in the FDA, they made a big thing about it. I always thought there should be a better way of enlarging the breast. Fat grafting at the time was banned by the Society of Plastic Surgeons as something that doesn't work. Well, we realized that if you really work on the science and you make it, you understand how it works, you can make it work. And I was one of the pioneers who back about 15 years ago reintroduced fat grafting to the breast. What we did is first understanding how blood supply happened, how a droplet of blood of fat can really survive. So it needs a blood vessel go in, and I have a little slide that shows how a tiny droplet will survive, but a larger droplet will die, the tissue will die before blood vessel gets in. So you have to spray in the breast a fine mist of droplets. Now there's no room in a small breast to do that. So what we did, then the next slide will show you, we developed an expander, which is a device that you put on the breast there and stretch it out. There we create a matrix, we create space, we create more blood supply, we make room for us to be able to spray those droplets and get them to survive. Once we put that, we really showed about 15 years ago that it's a very good procedure. The problem, of course, is you have to wear that device to make room for the breast. The device it used to be called the Brava device. It's no longer there. We've improved it. Brava 2.0, if you want, is now Eve, the external vacuum expander, and that's what makes room for the breast reconstruction augmentation. And the results are really interesting because you can really stretch a breast, as you could see the middle photograph there, and the blue line shows the lines of grafting. There's no incision. We're not cutting anything. We're just, with a needle, injecting fat in there. And the final photograph shows you 1 year follow-up of this young lady, essentially had very small breasts and has very nice breasts. And the MRI below the picture shows how we added more tissue all around the breast, normal, healthy fat. So we've proven that it's a nice way to augment your breast in a natural fashion.
Okay, definitely natural. And again, some of the other benefits about this. Sorry, some of the benefits also with fat grafting. You mentioned there's a quicker recovery. What are some of the other benefits that come with this? As far as there's no foreign objects in the body, for number one. Quicker recovery, as you mentioned, and some of the other benefits.
It's permanent. It's your own tissue.
Okay.
All right, and there's no scar. Nobody will ever know you'll have it done.
That's great, and we actually have a list of some of the other benefits as well. There's no cuts, no incisions. I mean, that to me is amazing.
We're not playing with your muscle, so your muscle is intact. There's no animation. There's no rippling. There's no capsule to be formed. You don't have a foreign body that's going to potentially cause problems.
And oftentimes it's a twofer. It's 2 for 1. You get liposuction, you get rid of the fat you don't want it, and you put it where you want it.
That's right. To me sounds perfect. You just like get rid of this in one place and put it somewhere where you do need it. Exactly. Right. And again, and to be serious to it, is again minimally invasive. I mean, most people nowadays in any kind of procedure, most people I think are fearful when something is an invasive procedure. So this is an option that's not.
But there's a caveat.
Okay.
You got to do it right.
Of course.
And you have to have a reasonable expectation. An implant, you could put 600 cc. Boom, it's there. This is subtle. This is more natural. You're not going to get a dolly parton enlargement with that. This is not something that you could notice across the room, this is something most women really want to have. They want to have a subtle, just something to make them feel a little fuller in their clothes without having to go through a foreign body and incision, etc. So it's the augmentation is not as dramatic, although it's there, but you have to do it right. Yes. That's the problem.
Absolutely.
It's more of natural results.
Okay.
Women that want to have the Miami Beach big breasts, this is not their procedure. This procedure is for somebody that really wants to have a nice, beautiful, where people turn their eyes, but they don't know exactly is that natural? Is that her breast? Is she augment? It's more of a natural thing. And two, just to sort of, it is a procedure, it's surgery. You require general anesthesia, and there are some complications and some risks associated with that, but we like to call this percutaneous surgery. It's minimally invasive, you don't make scars, so the recovery, obviously, it's going to be a lot easier.
Okay, good to know. And again, when we talk about the different procedures that this is used for, again, what are the most common ones that this would be used for with the fat transfer?
Well, it's really the best way to treat what we call tuberous breasts. So this is a young lady who had not only small breasts, but kind of deformed breasts, they didn't grow normally. Okay. That's the best way to treat them. It's a good way to treat congenital anomalies of the breast. And it's really the solution for women who have implants and really reach the end of the road, having had replacement many times and capsule and replacement, etc. Ma'am, we have your natural solution. Let's remove the implant and put your own fat there instead.
Okay, good to know. Now, one other thing, Dr. Khouri, I know that you mentioned you've pioneered at certain things, and you've also contributed other innovations, and one of them being the external breast tissue expander, or Brava. So, can you tell us what is that?
Well, we had one here. Basically, it's a device, and we had a little video that showed it. It's a suction cup, a modified medical suction cup that applies a gentle pressure on the tissues and makes them grow. Now, we're not really generating much tissue. We're stretching the tissues. But that's creating a scaffold, the tissue engineer scaffold, to really make room for us to seed cell. Tissue engineers, here it is.
Here we go, we have
Here
one
it
for
is.
you
There's
there.
one there for
Yes.
you here. So it's a gel rim that really interfaces with the body in a nice way so that it doesn't hurt too much, and it dissipates the pressure and the shear forces, and there's a vacuum pump attached to it, and it's worn at night. Basically, most women learn to sleep with it.
Okay.
All you got to do is sleep with it at night.
Okay.
You just have to wear it for 200 hours over a 15 days period. That's all you need to do.
We actually have a picture too of what it will look like if a person is actually wearing it, as you mentioned right here. So this kind of shows what it will look like if a patient is wearing the device that you're describing.
Yeah,
So-
this lady is actually going out with it with a large loose t-shirt, but most women prefer to stay home with it
Okay.
and sleep with it at night. So it creates a scaffold and allows us to put fat. On a mastectomy defect or a very small breast, there's just no room to put the fat.
Okay.
And that's why the procedure was banned, because people were just trying to inject large amounts without room, the fat would die.
Okay.
And then we'll have necrosis. So you have to prepare the recipient side, just like seeding a field. You have to have good seeds and you have to have a big field to put those seeds. Without having the big field, you can't put the seeds.
Okay. And I understand now, again, Brava has been changed to, it's known as Eve, correct?
It's really an external vacuum expander. If you
Okay.
want, it's the Brava 2.1. We've modified it, improved it, and made it easier to use.
Okay. All right. And again, just to confirm, can you do fat transfers without vacuum expansion?
Yes, you can, but you have to realize that the recipient site is limited. You can only put very little. So the careful, good surgeons would tell their patient, ma'am, it's going to take a number of procedures because they can't do it at once. So they're going to put only as much as you can tolerate, come back a few months later, put a little more, etc., etc. The dangerous one will just take a syringe and inject, and it will look great, but it'll be full of dead tissue. Now, we could do it for the buttocks. Who cares about cyst in the buttock? But in the breast, you really don't want to have nodules and things you can palpate.
Okay, sure. All right, well, doctors, we've gotten off to a great start here, kind of hearing about where things were, how far we've come, and some of the revolutions. We're going to get more into that, of course, and all more about these advances. And we're also going to be joined by a patient a little later on who's going to share her journey with us as well. A very inspirational story for sure. And remember, you are watching the Health Channel, all health, all the time, right here on South Florida PBS. And please be sure at any time to visit the website, allhealthallthetime.com, where you can submit your questions for the experts and learn all about the programming here on South Florida PBS. Stay with us. We'll be right back.
Wonder if you should get tested for colorectal cancer?
Is it really that common?
It is. It's the second leading cancer killer in the U.S.
I don't have symptoms.
It doesn't always cause symptoms, especially early on. And screening helps prevent the disease
Oh, how?
by finding precancerous polyps so they can be removed.
But that test.
There's more than one screening test. If you're 50 or older, talk to your doctor about which one is right for you. Colorectal cancer screening really does save lives.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
love your new birthday present. Are you ready?
Today, grown-ups will try anything to get kids more active outdoors. Good thing, since active kids have a better chance of building stronger bones and maintaining a healthy body weight. Here's an idea.
Let's go.
Get out there with them. A message from the American Academy of Orthopedic Surgeons and the Pediatric Orthopedic Society of North America, who remind you, for strong bones, activity runs in the family.
It's a teeter-totter.
Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. Well, I am so pleased to be speaking with Dr. Daniel Calva and Dr. Roger Khouri. Both are plastic surgeons with Baptist Health South Florida. And today we have been talking so far about fat grafting, a minimally invasive, incision-free alternative, traditional breast augmentations, and reconstruction. Now, later this hour, we're going to have the pleasure to speak with one of these doctors' patients, Chia Dambara, who underwent a double mastectomy and was a candidate for fat grafting. And I think first it's important to point out, doctors, earlier in the show, we were talking about fat grafting, and we also talked about the use of external enhancers in order to make that, expansion. So, but I know with Chia that's going to be different because it was internally done. So maybe Dr. Calva, you could just kind of explain the difference there before we even proceed further.
So actually one of our most common procedures is to exchange implants for fat grafting. So we remove the implants and we exchange them for their own fat. It's women that come in because they have a slew of problems and they want their implants out. So we basically use that exact same methodology, and we said, you know, let's use principles of that we know, and we need to exchange one space occupying thing for another space occupying thing. So with our patient that we're going to introduce, with Chia, we decided to put internal tissue expanders, which is something that all plastic surgeons and patients that are in the process of reconstruction understand very well. And it's basically a silicone-based balloon that you start to slowly, after it's been placed underneath your muscle, it gets expanded to the size that you want. That allows the skin to stretch. It's basically the exact same principles that Eve is doing. It's just doing it internally. It's creating space. It's opening up the skin and allowing the skin to stretch. And then what we do over 2 or 3 procedures, we get rid of that expander for a smaller implant, and then we get that smaller implant completely out, and then she's reconstructed completely with her own fat, with her own tissues.
Okay, thank you for that.
Well, basically, there are 2 ways of expanding. The externally, you stretch it out. There's no incision, no cutting. Internally, you stretch from outside. So that in both procedures create space. The whole thing is space, creating space for the fat. Okay. So now, when we have women already have their implants, they've been reconstructed with implant, they're stretched out. Right. All we got to do is go to a smaller implant, half the size, double the thickness, half the size, double the thickness. We do this all the time. Right. We basically have women with large implants after their mastectomy, paper-thin tissue around their mastectomy. Mm-hmm. They really feel cold, it's just hard, they don't feel like, it doesn't feel like their own tissue. And then we take the implant out, put half the size, now that creates room for the fat, put fat, double the thickness of the tissues. Do it again, and typically in 3 sessions, basically, we're able to give them breasts that are totally their own, without having an implant anymore.
Amazing. Mm-hmm. That really is amazing. Now, let's also point out who would be a candidate for this type of a procedure. I think that's also an important question, too, for people who might be watching. Who is a candidate for this?
You know, this is a question that we get asked a lot, especially by very thin women, because they've been turned down by 2 or 3 plastic surgeons and you're too thin, we don't have enough fat. And see, we work on the principles of our liposuction is very, very simple. We don't want to take too much from one specific area. What we want to do is through a large surface area, your entire body, so we go all your abdomen, your back, your arms, your legs, we take a very thin layer in all of these. So by having large surface area and we take a little bit, we leave very little to no contour problems. So women have no issues afterwards. And we get our fat. Even on women that are 100 pounds, we can get fat. So in all reality, I think everybody is a candidate for this procedure. There's very few things. If you're a smoker, is very difficult to do.
I was just going to say there. I know a few things that might disqualify a patient, and we actually have a list of some of those disqualifiers. So, and you just mentioned smoking, I guess, being kind of number one. And then, if either of you could also just kind of explain why these other issues, if you will, would make someone not be a candidate for this type of a procedure, what the danger is.
Well, if they're still under chemotherapy, I think we should wait until chemotherapy is done.
Sure.
That's obvious. The other one is the aspirin. When we inject the fat, we create a channel with a cannula, and we inject fat as the cannula is retracted. But if this channel fills with blood, there's no room for the fat.
Okay.
So you want to make sure they don't bleed. Since we're not cutting open, we have no way to cauterize the bleeders. So you want to make sure. So aspirin, a lot of those supplements cause bleeding. Vitamin E, a lot of they're healthy actually, but they do cause bleeding. And finally, the important one is the understanding of the procedure. The patient has to understand that this is not this. They got to work at it.
Right.
I take pride in the fact that 20% of our patients are nurses or physicians themselves.
Right.
Okay.
Wow.
So they realize that, you know, this is something you work at because you have to use the expander, you have to get it. And although the flap procedure is considered one stage, it really requires most people today do some fat grafting after this. They end up having 2-3 operations. But in 2-3 operations with this system, you're really going to get your own breast back, regenerated back inside you. This is a regenerative plastic surgery.
Okay. Now, we had mentioned that this procedure's been used for both cosmetic and for reconstructive purposes. So let's talk about reconstruction, and specifically when we deal with getting a fat transfer after a mastectomy.
We have actually a little cartoon that shows a little bit of what we do here. And I got to start by saying I was one of the pioneers of the flap procedure back in the 80s, and really was swimming against the tide, getting the flap operation, the big flap operation, accepted by the community. It was considered too much surgery. And I've done thousands of them, published a large series of those. And then one day I had to come to Jesus. If my wife needed this operation, would I do it on her?
Wow.
At the same time, the American Society of Plastic Surgeons did a survey of women plastic surgeons, ladies who do this for a living on their patients. They do care for their patient and do this operation. They asked them, 800 of them, God forbid you need a mastectomy or reconstruction, would you go through a flap procedure? Out of 800 women, not a single one of them would have gone through this operation.
Unbelievable.
That's the point at which I put my scalpel down and say, you know what, we got to find a better way for this. We got to find a better way. And this is how we developed this procedure here. So the cartoon here will show how the external expander, once it's placed on the breast, on the mastectomy defect, creates the, if you can animate it, creates the envelope here and slowly makes room. No, I need to animate the tissue there. Makes room for the fat to grow there. So we stretch the skin from the outside. We create the recipient scaffold, and we put the fat. And
unfortunately, doctor, we're having a little bit of a problem with our animator right now. That's why I know you're referring to it. We can't show it at the moment, but you are describing it very, very, very well. So it's helping.
So that's gradually we got this procedure accepted, but of course the awareness of the public is not there yet. It's the third alternative. Classically, women are told you can have an implant, you can have a flap. Really, they just told, just have breast cancer, and well, we can give you back your breast. You can either choose an implant or a flap, and go to my colleague down the hall, my plastic surgeon colleague. He'll do one of these two, whatever you prefer. Truth of the matter is, most of them go through that. They're not aware of this third alternative, which is the new way of regenerating breasts in situ.
And this is why we're so glad we're talking about this today, because this alternative is out there. And again, perhaps the knowledge isn't known yet, and that's why we're speaking with you. And here's a question that perhaps viewers might already be thinking. When you hear the word, fat transfer, if someone doesn't feel like they're fat enough, so to speak, or maybe they're lucky, they don't have unwanted fat, they'd want to move to some other part of their body. So what would you say to viewers who might be curious about that? Can you be too thin to have this kind of procedure? How do you gauge that? How do you measure that as physicians?
We prefer the fat of the thin patients. Fat of the obese patient are just bags of oil.
Okay.
Fat of the thin patient is cell. We like to graft cells. So our better results are actually with the fat of the thin patients. And as Dr. Calva said, we take a thin layer out of a wide area, and we've never turned down a patient for being too thin.
Okay.
As a matter of fact, there's good science on this. As you get the fatter you are, what happens is those fat cells, they just get full of oil. It's not that you're getting more and more of them. They're just nice and enlarged. So imagine those big cells trying to go through our cannulas. As they go through our cannulas, they lyse, they open up, they break. So you can see how when we're taking that fat out on an obese patient, we're gonna have less good fat that's gonna survive. We're gonna have more oil because they break. In thin women, those cells, the same cells, are really, really small. They're not full of oil. So what happens is, as we're doing liposuction, those small little cells go into our cannulas, and almost all of them survive. Okay. We have very little oil.
Another interesting fact: most plastic surgeons tell the patient, gain some fat, gain some weight before your operation. We tell them the opposite: lose weight, because when you gain it back, your breasts will get larger.
Wow, that's good to know. All right, and we saw there was actually a graphic that showed some of the ways that you do want to harvest, and it says, fat from thinner patients. So again, we know that you can harvest it, and the word there is skinny, but it sounds like there's a lot of benefits to being
this
not
is
overweight
a
and
great
having it.
graph, because we use this to educate our patients. We take our hands and we can measure the surface area in our hands, so we can tell them this is how much fat we can get out of each area.
Amazing.
And this is how much we can transfer. That's why you're seeing those little hand things.
Okay. One thing before we're going to have to go to another break, but very quickly, every procedure, there's always a little bit of a risk associated with anything that we have done. So can you just touch briefly on some of the risks that people might be facing in this kind of a procedure?
Absolutely.
Well, the obvious anesthesia risk, which is really minimal today, a little infection, blood. Since we're not opening tissue, the risk of bleeding and hematoma is really very rare. The main risk really is if you're injecting fat that doesn't survive. If you inject blobs with the big syringe, you're going to have nodules all over the breast. And that's a big problem, because makes you all anxious and nervous. What are these all about? And they unnecessary biopsies, etc. And that's the reason why the procedure was banned in the first place. So the main risk here is having palpable nodules that are worrisome, and we minimize it with our technique of grafting very thin fat very gently in a space that we created so that we enlarge the field to put more seeds. We don't stuff more seeds in a tiny field.
Okay.
And that's actually a key point. We get an MRI on all of our patients, and we get a 6-month follow-up MRI, so that we have a good baseline of how their breasts look, so that if in the future they come back and oh, doctor, I feel a little nodule, we can get an MRI, we can compare. And 99, almost all of these things get resolved because they look like fat. The radiologist identifies them as fat. So we can take an ultrasound and we can just get rid of it really quickly.
Okay. We have a lot more coming up, and before we wrap up this hour, I do want to show, we have a picture. We've been talking about mastectomies and how this can work for patients, and we do have a visual to kind of show a before and after of someone after a bilateral mastectomy. So again, this kind of illustrates kind of what can happen, right, and how a patient can see changes after undergoing this procedure.
That's right.
Yeah.
Yeah, and you can see how beautifully that lower pole of her breast looks. Yeah. I mean, it looks like she has implants. I mean, she looks like she's been reconstructed with the traditional methods.
Right.
But this is really, as you were saying, the third method. We like to call it the best method.
Okay. Third time's a charm, as some people like to say. And we also have a visual of, we showed that was after a bilateral mastectomy, but also what women look like after breast augmentation for cosmetic purposes. So again, this kind of illustrates a big change, I'd say, in both patients, right?
Yep.
That's right. And they're static. It's their own breast. They feel like their own breasts. They move like their own breasts, which sometimes with implants they don't. With implants, they feel like they have something foreign. It's not their breast anymore.
Okay. Well, again, like you said, the third option, the best option, but we've been learning a lot about it, and we have to take another quick break, but when we come back, we're going to be learning even more, and we are also going to hear Chia Dambara's story. It is so inspiring. You do not want to miss it. So be sure to stay with us. And please remember to visit our website, allhealthallthetime.com. You can submit your questions for the experts and find out all about the Health Channel right here on South Florida PBS. We'll be right back.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe one or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed, and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon.
Well, welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. I am here with Dr. Daniel Calva, a plastic surgeon at Baptist Health South Florida. And also joining us for this segment is one of Dr. Calva's patients, Chia Dambara. Thank you for being here today to share your very personal story, Chia. We're really thrilled to have you with us. And Chia, I know, again, you've been through a lot. From what I understand, you had a double mastectomy at the age of 24?
Yep.
Is that correct? So, again, unbelievable experience. And tell us, how did you even find out you needed that surgery? What led to that happening in your life?
So I tested for BRCA1 positive in 2015. And I met with some doctors, specialists in cancer, genetic-related cancers, and was highly recommended looking at my family history to get a prophylactic double mastectomy.
That's unbelievable. Now, you know, for some of our viewers, they may not know about the BRCA gene that you said you tested for. So again, what you know, just tell us about that. Kind of, again, why you tested for it in the first place. Sounds like, unfortunately, there's some breast cancer history in your family. So what led you to even get tested for this?
Yep, so the BRCA gene, everybody has it. When it's mutated, basically, to put it simply, it's it's a bad gene. So you have a higher risk of developing breast and ovarian cancer. And so looking at your family history, if there's a lot of women with breast cancer or ovarian cancer, they'll either do a double mastectomy prophylactically, it's a choice, or an oophorectomy for your ovaries. And my mother passed away from breast cancer when I was 6. She was 39 years old. My grandmother, great-grandmother, 2 of my mother's sisters, they all had breast cancer, and the only survivor in our family is one of my cousins who developed breast cancer at 29. And she was tested, so when I was 23, I decided I also wanted to get tested to see if I had the gene.
Wow. I'm very sorry about your mom and for all the women in your family who lost their battle with breast cancer. I'm sorry to hear that, and you have been extremely brave in doing what you did. You know, we heard about this once. I think a lot of people might remember Angelina Jolie, you know, talked about this. Again, a celebrity, right? So to meet a person in everyday life and to share your story again is so important. Doctor, let me also just kind of ask you too, when did you meet Chie, I guess, in part of this journey, and what was, I guess, unique about her case when you met her?
Yeah, you know, when she came to see us, she was already diagnosed. She is a very, very smart woman. She was doing her research, and I think at some point she came to the realization she didn't want to be moving muscle. She didn't want to be going through implants and all of these, you know. So she wanted to use implants as a means to an end, to have reconstruction of her breasts with no foreign bodies, ultimately. So she presented to us. We discussed the options, and I always talk to all my patients about their alternatives and what they can have done. And ultimately, she's a very, very smart woman. She said, "No, I really want to get a tissue expander." And with her, we actually did the internal expansion, and then we exchanged them for implants. And so we did nipple areola sparing mastectomies. And by the way, to talk a little bit about mastectomies, you can do something called simple mastectomies, which is basically you're totally flat, they remove everything. They remove nipple areola, skin, everything. They close you, you're nice and flat. You could do skin sparing, that means they remove the nipple and the areola, but they leave the skin envelope so that you can have that skin envelope. Or you can have what Chie had, which is nipple areola sparing mastectomies. So we make a small little incision underneath the areola, like if you were going to put an implant for cosmetic reasons. Okay. And through that small little incision, we can absolutely remove the entire breast gland. Wow. So we did that, and then we placed a small tissue expander. We expanded her to when she was very happy with her expansion, and at that point we started to, over a course of 3-4 operations, we exchanged those implants for her own tissue with fat. Okay, so again, there are several surgeries involved here, I know. So backing up again, so Chie, after the bilateral mastectomy, how long were you in the hospital after that happened?
So I was in the hospital for 3 days, and recovery was, I think for about a month I couldn't really do much. I couldn't even wash my own hair. Yeah. And then probably like 3 months to get fully active again. Okay. And since then, you've again had different procedures. Have you been in and out of the hospital then multiple times for this? So I've had in total 6 surgeries, but not every surgery was hospital. So only the first one was I stayed in the hospital. Okay. You know, we were talking earlier about some of the complications, if you will, or the setbacks with some of the traditional procedures, including implants, which again you did have. So what kinds of complications did you experience yourself when it came to the implants? So I had implants, 405 cc implants first, and I think about a month after my first reconstruction, I started to notice a lump under my right axilla. Okay. And so I had to get it needle biopsy, ultrasound. My doctors wanted to make sure that there was no cancer cells in there, so I had to do an MRI, a CT scan, and then ultimately a surgical biopsy to actually remove the lymph nodes and see what was going on there. And we realized that it wasn't cancer, so it was most likely a reaction to the implants. And as my doctors gradually made the implants smaller through surgery, my lumps started getting smaller. And now that I'm totally implant free, I don't have a lump at all. So
that's wonderful.
where I used to be, it's totally just normal now.
I mean, but that must have been kind of scary, I would imagine. You just had this, radical procedure done, if you will, and now you had a lump. So that must have been a frightening experience to go through that. So what was it then that led you to want to go through with the fat transfer? Was it, again, just you had enough of this problem with finding a lump and having to have these tests, or what led you to that decision?
So to begin with, we did a lot of fat transfer from the very first surgery. Okay. And I did a lot of research, like Dr. Calva said. I tried to look up my options, and I've had read forums and forums of women who had a reconstruction surgery with implants and all the issues that they had. So, after having actual implants in and seeing how hard they felt and how uncomfortable they were, I would wake up every morning in pain. I really didn't want to have that for the rest of my life. If I was cold, it would start to twitch. It was just a completely uncomfortable feeling. And really, now that I have absolutely no implants and it's just total fat, I don't see any of the issues that I had when I had implants.
That's unbelievable. And Chie, we've been talking about just kind of what you've been through physically and what has happened to your body, but I mean, obviously as a woman, we think of breasts as what makes us feminine, and I can't imagine the emotional toll of what you had to go through, with your family, knowing your history, and then making this decision. How did you deal emotionally with all of this, with knowing you would lose your breasts, knowing that you would do something about that after the fact? But again, emotionally, what has this been like for you?
So, first of all, I think the part of that question is also how I made that decision to undergo the double mastectomy, because it was a choice. I could have not done it, wait to see if maybe one day I'll develop cancer or not, or do the surgery and significantly reduce my chances of developing breast cancer. And to answer that is, I was 4 years old when my mother was diagnosed with breast cancer, and I watched her suffer through breast cancer, and ultimately her life was taken from breast cancer. So I had a fear, like I still have it, a tremendous fear towards cancer. And so I had this fire in me that I'm going to do whatever it takes to prevent that. And my best choice as a BRCA1 patient is to undergo a double mastectomy. And at the same time, I also wanted to prove to myself and to everyone around me that this wasn't going to define my life. So I launched my business. I started working on my business immediately after I had my double mastectomy. And throughout these 2 years of 6 surgeries, I've successfully, thankfully, grown my business significantly. So I was able to put all of my passion, motivation, focus into my business, and not the fact that I was in and out of the hospital all the time. So yeah, that was kind of my go-to throughout all of this. And the change of my body, I think it was always, there's an end. So after every surgery, 6 months, I wouldn't notice so much the scars because they would start to fade. Like they said, the incisions are very minimal, so you can't really tell that I've had a surgery. People, if I walk on the street, nobody would have any idea that I've had so many surgeries. Sure. And even if I'm wearing a bikini, nobody can tell. So there was a lot of fear going into it, but now that I'm done, I'm very happy with the results. I'm happy that I'm no longer at such high risk of developing breast cancer.
Wow. Well, again, Chie, amazing story, and congratulations on getting through so much of that and to your business and everything that you've accomplished despite everything that you've been through. Your story is so inspirational, and unfortunately we have to take a quick break, but we're not done yet. Okay. So we're going to hear more from Chie when we come back. So please stay with us. You're going to want to hear more from this amazing patient and her inspirational story. Don't forget to visit our website as well, allhealthallthetime.com. We'll be right back. You
have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. No one should face breast cancer alone. When I was diagnosed 36 years ago, there was no internet, and I had to make a decision with little information. Early detection saved my life. It could save yours too. To learn what every woman needs to know about breast cancer, visit nbcf.org/hope.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. I am here with Dr. Roger Khouri, a plastic surgeon at Baptist Health South Florida, and we are also joined by one of Dr. Khouri's patients, Chia Dumbara, and she's been here today sharing her story. We thank you so much for being here. In our last segment, Chia, you were telling us about some of the complications you had with your breast implants after having your double mastectomy, and I guess first question is, have you had any problems? I think you said you've been not experiencing problems, but just to remind us how you've been feeling since the fat transfer.
So my last surgery was 6 weeks ago, and I'm still in recovery, so there's still some parts occasionally that feel a little pain, but overall, like the chronic pain of the implants, I don't feel it anymore. I don't have it anymore, so I definitely can tell a difference. Already from the second reconstruction, when they made the implants half the size, I started to feel, I stopped feeling that chronic pain that implants gave me.
Okay, that's great to know. And I just learned we actually do have a couple of photos that you were kind enough to share with us,
Sure.
just to kind of show our viewers too. So I understand this is after you had your mastectomy, is that correct?
Yeah, that was immediately after the
Wow.
mastectomy.
And you look great. I mean, you just went through something really difficult. And then, and look at you here, looking
Yeah, this
happy.
is after the third reconstruction surgery.
Okay, well, and you're smiling all the way, and again, just the epitome of positivity and an amazing attitude. So, Dr. Khouri, just again, to me, an amazing young woman, but what was unique about Chia's case when you met her, and what can you tell us about her?
Well, she was in college with my kids.
That's amazing.
That's how I got to. That's how she got to us. She
Yeah,
was in school with my
great.
kids, and my daughter knew that's what Dad does, and so she told she, and she flew to Miami. She actually moved to Miami to have this done here.
Mm-hmm. Amazing.
And so I know her because she's a friend of my kids, and it's really unfortunate that most women don't know about it yet.
Yeah. Well.
And she has had a number of procedures. We didn't use the internal expander on the external expander on her because there was a period where the brow was not available, Eve was not available yet,
Okay.
and we didn't have it. And so she had to go through the implant. So she can tell the difference between implants and your own tissue.
Mm-hmm. Yeah.
It's amazing.
And she noticed also, of course, along the way we've done four liposuction procedures on you, I think.
5.
5 liposuction procedures on you.
Okay.
So I think they've been overall also an improvement, don't you think?
You know, I was actually going to ask you where did the doctors get the fat from your body to do this procedure? So
yeah, so mostly my thighs and my back, hips area, and then a little bit from my arms as well. Like they explained earlier, they take a small layer, so kind of to keep it all symmetrical, not that just my legs are extremely thin or, you know, just my hips. It's kind of all going down, so
all
very
together.
natural.
And just out of curiosity too, the areas where they took the fat from, I'm just curious about any recovery issues, so to speak, in those areas, any tenderness, or was it anything there?
No, and honestly, so for example, my arms, you probably can't tell on the camera, but this is like the incision, so I don't know if you can see, it's very small.
It's so small.
Like, it almost looks like, I don't know, like a scratch.
It actually looks like you might have gotten an injection at some point, or like you said, a scratch on your arm. So believe
so
me, at home
they're
you wouldn't
very
be able
small.
to see it.
You really can't tell. I have other scars that you can see more from like falling down or something like that. So.
Okay. So that's not bad at all. You know, doctor, I'm just also curious. I mean, obviously there was the procedure itself that she had to go through, but emotionally there's a lot that this young woman went through. So, how did you help Chie? How do you help your patients? When they are going through something like this. I mean, there's a lot of emotion involved.
It is emotionally late procedure. We have a team actually that helps them. We have a couple of nurses who follow the patient throughout, and they build a relationship with the nurses. The nurse is available 24/7 on the phone to answer their questions and talk to them, whatever they have. We see them very frequently if they live in Miami. Unfortunately, most of my patients travel long distance. They hear about us. It's not available in New York or in Chicago, wherever they live, and they fly to Miami to have it done. So that but the internet has changed things. We can see photographs, we can chat online, and we can exchange. So there's a lot of support. It's a process. We actually grow back a breast. This is not boom, we'll put an implant, or we take a patch and put it here. We actually gradually grow back a breast, and it's a process, and we can't do it overnight. It takes a year for a breast to naturally grow. We're not going to beat nature. So it's a process. It takes about a year. And I tell my patients, ma'am, we're going to grow back your breast. You've lost it. We're going to grow it back. But you got to take time. It takes time to grow, and you got to work with me on it.
Sure. But it's an amazing process. And Chie, in addition to working with the doctor and the staff, obviously a great staff of support, what other support kind of got you through all of this? I mean, you talked about, I know you were launching a business and obviously a lot of energy there, but what other support did you lean on? Friends, family?
Yeah, friends. I have a cousin who's kind of like my sister that also lives in Miami. Dr. Khouri knows her very well. She's been through all of my post and pre-surgeries, and a lot of my friends. And then, of course, from the beginning, there's a lot of financials that you need to take care of. So my brother and my father helped me out a lot with that as well.
Well, that's actually, and you bring up a good point there, because one important question we should ask is this procedure covered by insurance?
Of course, we have to. Insurance, this is one of the alternative methods of breast reconstruction. We actually published a study showing that is actually by far the most cost-effective method of breast reconstruction. It's got the lowest complication rate, the most predictable, and it's done as outpatient as compared to doing it in the hospital. Except for her mastectomy, which had to be done in the hospital, all the other procedures were done outpatient.
Wow.
So right there's a tremendous saving on the healthcare industry and the healthcare system. So it's insurance companies realize that is actually the better way to go. So they're all covered by insurance. Of course, anything new, you have to make some strides and push it.
Right. Pushing is good, though, but that's why we have advocates in ourselves and with the doctors that help us as well. Doctor, let me also just ask you I know every patient is different, but what is kind of a typical recovery like for patients or your patients? Is Chie kind of a typical, or what are patients going to be looking at after the procedure?
Well, she had a little problem because she had problem from her implants.
Yeah.
So we had to worry about that. We had to biopsy her, and we're really concerned at one point. And so, but the woman who has her immediate reconstruction using this technique of external expansion, if she's not radiated, it's really going to be a smooth process within 3 procedures. Yeah. The difficulty comes in if they've had radiation.
Okay.
So once they're radiated, the tissues don't accept fat very well. The tissues are really, it's an arid field. You can't put seeds in it more in a field that's been burned by radiation.
Okay. And I'm sorry, doctor, but we want to make sure we end with Chie because she is an amazing woman. Very quickly, we're almost out of time. Brief message for other people who might be going through what you're going through. What would you like to say to them?
Do your research, really know your options. I think that's the most important advice that I can give to anyone, because you want to know exactly what the doctors are going to do. Ask all the questions that you want to ask. Talk to other patients that have been with that doctor, and just keep your positive. Keep your positivity, keep thinking for, it's almost over. And I remember that I was in pain, but I don't remember the actual pain. So, today I'm happy that I'm myself. I don't have any foreign objects in my body. I have less than 5% chance of developing breast cancer, and I feel and look great.
Well, Chie, you are an inspiration to everyone. Thank you so much for coming in and sharing your story.
Thank you so
much.
much.
All the best to you. And Dr. Khouri, thank you for your time
Thank
as
you.
well. And thank you all for joining us so much. We appreciate you being here. Make sure to check out our website when you can. Join us on the Health Channel the next time. See you soon.